Good morning. As you see in the program, I am supposed to be joined by one Dr. Franclo Henning, who came all the way from Cape Town and then got waylaid in Munich and is currently still waylaid in Munich. Unfortunately, he's been texting me. He's in his warm weather South African clothing, and he can't really even leave the airport or the hotel because he doesn't have anything to wear. So just wanted to say that I will be presenting this on my own. But Franclo was going to present with me. He is a board member to our foundation, and so it was really important to share his voice as well. So I'm Melinda Kavanaugh. I'm a professor of social worker. I'm also a licensed clinical social work. And I am incredibly excited to talk about this organization. I'm sure over the years you all have heard me present in various different ways and in different presentations about my research, my clinical work, really around focusing on children and youth in families with ALS and MND. But I also do work across other neurological disorders. And what really stood out through all of these presentations and through all of the research over the years is that A, there's not enough research in this area, and two, on a global scale, we really have a gap. There is a really a large missing area that says what projects and research and work being done in one area needs to and very well can be translated and applied in another area and language as well. So I took that ball and ran with it. So very briefly, I am an academic, so I'm going to try not to have a billion slides, but bear with me. Why are we focusing on children and youth? What we do know is that children and youth rarely have all of the information. Often it's because parents are concerned, they're scared, they don't have the information. So therefore, that's one way we have a gap in families, that children and youth really don't have all of the information and the support. What we also know is that children and youth are what we call young carers. So as young as 6 in my research across diseases, children are actively engaged in care. And that means that they are bathing, feeding, toileting, transferring, dressing, really providing hands-on care. But the level of education and support and information provided to these children is really not there, regardless of where you are in the world. Shout out to the UK. Doing a really good job on that. Not a shout out to the US, doing a terrible job on that. What we do know about global programs that really address children and youth who are caregivers, children and youth living in families with illness, they focus on HIV/AIDS, they focus on cancer, or they focus on children themselves with an illness. And very few global, and I mean few as in a handful or fewer than that, really address neurological disorders. And that does include ALS and MND. Oops. So in creating Global Neuro Y Care, we took a step back, and a lot of the work, like I said, I've been doing this for many years, but I haven't been doing it in isolation by any stretch of the imagination. I have been able to collaborate with some of the most amazing organizations, a lot of whom are in this room, in addition to other organizations that represent neurological disorders around the world. So as a licensed clinical social worker, I spent many years working with families directly in clinical settings, directly in homes, nursing homes, long-term care. I also do all my research. I'm a developmentalist. And understanding all of these things and working with different organizations, really building all of these relationships and people saying, why don't we have more? What can we do? How can we do this? How can we work together? And one of the things that I want to make sure is really, really important through all of this is the words, the voices, and the engagement of the children are front and center to our organization. All of the research I do uses their words. All of the books, all of the programs that I have created over the years, myself and my colleagues, have been absolutely driven by the children and their families so that we make sure that their voices are front and center and their voices are heard above and beyond the adult voices in the room. So what is our mission? So we are an international nonprofit organization. We are based in the United States, but our board is actually an international board. So we are not an exclusive U.S. organization by any stretch. So we seek to engage organizations, quite a few of you in this room, develop education for children, youth, families, and professionals, and provide support programs for young carers. And that last piece, again, is critical because very few places around the world really address the role that children and youth play as a caregiver. And I'll talk in a minute about one of the programs we have. So our tagline is kind of across the globe, across neurological disorders. And one thing I know in speaking with different conferences and different presentations in the U.S. and around the world across developmental kind of groups and neurological disorders. Tanya said just a moment ago about silos. Boy, there's a lot of silos there. And a lot of the work I do in Alzheimer's and related dementia, a lot of the work I do in Huntington's disease and in ALS and MND, they're all very, very similar, but nobody's talking. So that's another thing that's really important to us as a nonprofit is to continue to try to reach across those lines. So the first thing we do is educate. Many years ago, I had the absolute fortune to receive funding and support from the ALS Association to start creating books for children and families. And these books were all born out of, again, my research, the interviews. What do the children know? What do they not know? What do they need to know? And so we have a whole series of books for young children, kind of tween children, young adults, a family guide, as well as a guide for school personnel. And I also had the really great fortune a number of years ago to be contacted by organizations to say, how can we translate these books? How can we get them in our language? And actually, the first organization was the Swiss organization. And they reached out, and it's now in French and German, thanks to the Swiss organization. But the graphic novel is also in Dutch, thanks to ALS Netherlands. It's in Afrikaans, Zulu, Sesotho, and Xhosa, which is a combination of collaboration with the MND South Africa. I'm also in talks, or not talks, because everything is freely available. I'm also in communication with the Portuguese Association and Korean. So we will have the graphic novel also in Portuguese and Korean soon. You'll also see the Y-Care book there. I'll talk about Y-Care in a minute, but Y-Care has also been translated into all 4 of the South African languages, and it's in process of being translated into Spanish as well. So you'll see that our goal is to not keep anything close, is to keep everything as broad as possible and as accessible as possible. Our next project, which we are incredibly excited to get started on, is developing professional education for healthcare providers. Someone mentioned breaking the news a moment ago, and I have the absolute honor to be a faculty member that helped create that program. And it is so impressive to see how many people respond to the need for healthcare providers, for allied health professionals, to really have that support in how to deliver not only an initial diagnosis, but along the way of the prognosis and living with ALS. Well, something very similar has been frequently asked of me, and I've given multiple webinars on this topic over the years, is how to help our families have that conversation. And without that conversation, how is that impacting their clinical care and their own progression as someone living with the illness or the adult caregiver? So we're putting together a program that's going to be webinar, in-person workshops, and educational materials that will help the provider start and have that conversation with the family, because there's a wall there that often goes up. So that's our next project. So I'm very, very proud of this slide because this shows how wonderful engagement can be and how important it is for us to partner with as many organizations as possible. The one I realize is not up there. My bad. You're not looking, are you, Kathy? The International Alliance isn't up there. But I'm up here, so that means there we are, right? Don't look. I know, really, Melinda. But one of the, another program we're working with is ALS Canada, developing program for children around genetics. How do they understand it? How do we talk to them about it? It's a fantastic partnership. As you see, the Korean Association translating all the books into Korea, South Africa. I've been working in South Africa for almost 10 years now. It's my second home, and it's the most extraordinary group of people who are extremely dedicated to how to figure out how to do this work with beyond low-resourced areas. So, and also our industry partners, both Amylyx and MT Pharma, have been incredibly supportive of our work and really reaching out and helping us understand how we can help children and youth. I'm ignoring you, Jess. So the Y-Care program, I'll go super quick because I really want to get to the other. The Y-Care program is our youth caregiving training program, has been going on for many years now. We've expanded it into Alzheimer's disease and related dementias, autism, and Parkinson's disease. We also have a program in collaboration with New York University on cancer care. This is where we give children and youth the hands-on support. They get to meet peers, they get to meet health professionals, they get to learn the care skills that they're missing, but they get to develop that support and peer-engaged program as part of that engagement. The other thing I'm really excited about is our film Lukey and the Lights. So we're going to be premiering it tonight. This is also, you'll see here, is a coloring and activity book that I worked on really, really closely with the producers of the film, and I'll be introducing them in just a second. But Sasha, she's looking at me. It's an animated short film about a robot who gets ALS. The key piece here is that there's no language. The whole point of us over all the years, and it's been, we were counting them down the years last night. I've been involved in it for 4 years. Sasha and Anjo, who are sitting right over here to my right, my Dutch fabulousness over there. Yes, absolutely. Round of applause. So they wrote this story because when Anya was diagnosed with ALS, they didn't know how to say that to their children. And while there were some resources, there wasn't something really extremely clear and easily digestible. So what they did is they wrote the story. They reached out to see who can make an animated film. Sasha's just a rock star. Connected up with Big Grin Productions, that is an actual animated Hollywood frou-frou organization. And then Sasha also reached out to me and said, hey, I'm writing this film and you do children and youth. You want to play? And I said, absolutely. So that was 4 years ago. So, and in the entirety of those 4 years, we have had so much support, not the least of which initial support through the ALS Dutch Association that has been really wonderful from the beginning. And most recently, and most importantly, a massive financial support from the ALS Association, who has really given us the oomph and the boost to be able to get this film out there. So we're incredibly excited for you to see it. You'll be able to see it tonight, but it'll be available to the world come early spring. And our goal with this film not only is to have it be no language, so it's available to everybody. We have the coloring book. Something I didn't show was to see that Ask Lukey at the bottom. We've put together a whole packet of educational materials where Lukey is the robot, kind of guides children into asking the questions, gives them that kind of comforting, fun robot, so it's a little less scary and stigmatizing when you're talking about ALS. The last thing, and here's a little still from the film, little teaser, super cool. The last thing that we do as an organization, and this was born out of my initial work going into South Africa, when I first started going, the clinics that I worked with said, hey, do you have any things in the US you can bring to us? And I was like, okay, so what? That built into bringing multiple suitcases of donated supplies. And sometimes those supplies are as basic as a gait belt. Sometimes they're more complex. I have brought communication devices. I have brought BiPAP machines, all donated by families in the community where I am. I'm based in Wisconsin, where I'm a professor of social work at the University of Wisconsin in Milwaukee. So that is a real key piece that we want to make sure we keep doing as a foundation, because children and youth, in providing care, often don't have the tools to provide care. And sometimes these tools are, again, as basic as a gait belt, but sometimes they're more complex. So one of our real excitements is to be able to build this beyond just with South Africa. I just got that. Okay, so we would love to hear from you. We would love to talk with you about continuing collaborations, building more kind of organizational connections, translating more materials, and it's an absolute honor to be here, and thank you all so much.
Thank you, Dr. Kavanaugh, for that presentation. Do we have any questions from the audience? Oh, over there, please.
Thank you. Hi, my name's David. I'm a patient fellow. And I was curious if you could talk a little bit about, when you're doing training of youth and children, how you balance training them versus what's appropriate or inappropriate for a young person to be doing, because it sounds like they're covering lots of different functions.
No, it's a really great question. Well, first of all, I am a licensed clinical social worker with many years of training in clinical care and children and developmental science. So we approached it from, what do children understand, how do they learn, and what are kind of those limits? Right? So in developing it, we did go through many iterations where we talked with the children, we talked with the parents. What worked, what didn't work? Were there some anxieties? Were there some fears? We also work with all of the multidisciplinary healthcare professionals that are part of it. They go through a training to be a Y-Care professional. So anytime a child says, I don't know, they're immediately pulled out. We give them support. We ask the question. Sometimes it's just overwhelming simply being in a room with that many people who understand what you're going through. Quite frankly, that's a lot of the emotional response we get from the children, is they're for the first time in a fully supported, understanding group, and with peers like themselves. But we have also been very careful about what skills we teach them and don't teach them. We ask them what they're already doing and what do they need help with. One of the things we ran into when we did it in South Africa, and we completely revamped it to the South African context, was they wanted more training on wound care and bed sores, whereas in the US we don't see that as much. So we do adapt it according to the cultural context, but they have a professional guide with them at that time. Yeah.
Okay, we had another question.
Thank you so much for this wonderful presentation and all the great work you do. I wanted to call out, shout out the work that you and ALS Canada, Paula, David, you all are doing on the genetics for children. You know, currently, as in the genetic community, we do refer people to the HDYO website, which I know you helped create lots of wonderful material. So I wanted to cheer that. And I also did want to ask, as a person in this space, you know, in the genetic community, studies are starting to go into childhood because they're, you know, seeing impacts of these diseases starting very early. Is there best practices for neurological, brain-based research into children? And how could we best be advocates together on that? I just wanted to raise that.
No, there absolutely is. There's actually more research going into that area, but one of the maybe cautionary tales or the concerns, particularly when it surrounds disorders that are genetic. So I'll take an example, given my history in Huntington's disease, most of the healthcare and physician medical organizations in the United States don't test anyone under the age of 18 for a genetic disorder unless it does present prior to that age, right? So if we're talking about adult onset genetic disorders, most of them do have very strict guidelines about when we do and don't test minors unless they do present clinically, and there is a juvenile Huntington's version. But, you know, it becomes much more complicated when the family is trying to plan and the family is trying to understand implications and what they can and cannot do. And I always, when families have brought this up, strongly encourage them to connect with their genetic counselor. There's a wonderful kind of group of professionals in genetic counseling that can help them walk through that. But that's usually the thing that we have run into the most, is the age and the consent and when you can and can't test based on when the disease typically presents itself. That's a good question.
We
Thanks,
have
Jean.
one more from the chat group.
Yes. So the Aspa Carabella from the Hellenic ALS Association, being formed in Greece,
Nice.
would love to translate the books in Greek.
And we would love to translate the books into Greek. Yes. That sounds fabulous. Yeah, absolutely. So all of my information was on the slide. It's, you know, and the whole goal is to get these books out as quickly as possible in as many languages as possible. So let's do it in Greek.
Yeah. Remember, you have the virtual access to the portal. You can text the speakers or anybody in the meeting through there. So we have one more question from Gujin.
I wonder if there is any possibility to publish your books on the internet.
They already are. They already are.
Because books sound expensive and difficult to spread around, but I would love to make this Icelandic version on the internet or our home page.
Absolutely. So the majority of the books have always been available on the ALS Association website. All of the books plus all of the translations, including the most recent South African translations, are also available on the Global Neuro Y-Care website. We just partnered with caregiving.com, which is a very large online caregiving resource in the United States. They have no resources for children and youth as caregivers, so our graphic novel is the first and only resource at the national level for children who are caregivers, and it represents families in ALS and motor neuron disease. So that's also, all of them are freely available. You can download them PDF. You can just read them online. You can do whatever you want. Absolutely. They're all there.
Okay. That's all the time we have. Thank you, Dr. Kavanaugh.